Well, this sucks. I'm recording this on March 31st, 2020, and as I'm sure you're all aware of by now, this spring has been kind of a mess. Ever since COVID 19, commonly referred to as the coronavirus, took hold in China's Wuhan province and rapidly began spreading across the globe, countries all over the world have been suffering from severe shortages of doctors, nurses, hospital beds, and medical supplies. To make matters worse, the social and economic consequences of this virus have compounded a number of already existing problems, including homelessness, unemployment, and access to food. According to statistics publicly available on the World Health Organization's website, at the time of this recording, there have been more than 693,000 confirmed cases of COVID 19 worldwide, as well as more than 33,000 coronavirus related deaths. And those numbers, as I understand, are expected to rise perhaps exponentially for some time. Make no mistake, this isn't just like the flu. Statistics are easy enough to read online, but we have to remember that these are real people that we're talking about. This is something that we all have to take very seriously. I haven't mentioned anything about this on my channel yet because I'm not a medical professional. I play video games. I've generally avoided the topic because I thought that it wasn't really relevant to what I'm doing on my channel, but I was wrong to think that way. We're all human, and this pandemic will almost certainly affect all of us eventually, whether directly or indirectly. In my case, I still have two living grandparents, and I'm genuinely concerned about their safety right now. With no vaccine and no cure available, it scares me to think of what might happen if one of them catches this freaking thing. And I'm sure many of you have similar concerns as well. So far, the best thing that any of us can do to help is likely what you've been hearing from medical professionals, governments, and international organizations for quite a bit of time now. Wash your hands thoroughly and regularly using soap and water. Avoid touching your face. Cough and sneeze in your upper arm or shoulder, and isolate yourself from other people to whatever extent that you safely can. Even though COVID 19 is statistically far more dangerous for older people or people with compromised immune systems or other serious medical conditions, it's important for the rest of us to remember that anyone can catch it, anyone can carry it, and anyone can transmit it. By following the guidelines that I just mentioned, young and healthy people can avoid spreading the virus to those who are most at risk. This buys valuable time for medical professionals to work on treatments and vaccines, and also helps to slow down the rate of infection so that hospital systems don't get overwhelmed. Beyond social distancing and good hygiene, though, what can the rest of us do to help? Well, with a quick Google search, it's pretty easy to find plenty of great relief efforts to donate to, from the local level to the international level. So, if you have the financial resources available to do so, I would encourage you to start there. As for me, I'd like to do my part by announcing that beginning today, I'm going to start sending ad revenue from this channel, which is currently about 30 US dollars per month, towards efforts to fight COVID 19. YouTube summarizes revenue for creators based on the last 28 days, so at the end of every month, I'll be checking that, rounding it up, and donating whatever amount that is. I just made my first donation today. Although I live in the US, more than 70% of my viewers don't, which is why I've decided to put my support behind the World Health Organization's COVID 19 Solidarity Response Fund. If you'd like to learn more about this fund yourself, I'll put a link in the description below. As to how long I'll continue to make these donations, I'm not really sure. I suppose I'll have to revert back to normal at my own discretion, but I'll be sure to let everyone know when I do, probably via a post on my community page or something like that. As of right now, no one can say for sure when this coronavirus nightmare will be over, but it will eventually end. We humans are stubborn. Sometimes that can be a weakness, but in situations like this, it's one of our greatest strengths. We aren't just going to let this dang thing run its course without putting up a fight. We will eventually get it under control. On that note, I want to take a moment to offer my sincerest thanks to all of the heroes who are on the front lines fighting to protect the rest of us from COVID 19. I'm talking about doctors, nurses, EMTs, paramedics, police, firefighters, other emergency responders, medical scientists, and all of the administrative and logistical staff that support them. You people are literally the best of us right now. I know you're working long hours under dire circumstances, often putting your own health at risk for the safety and well being of others. You deserve praise every day, even in the best of circumstances, but it's times like this that the world needs you the most. Thank you so much. In the meantime, the rest of us must do what we can to watch out for each other. We'll get through this eventually, and we'll do it together. Thanks for watching, everybody, and stay safe out there. I'll see you in the next video.